want to bring you one parent's experience with all of this. John Greenhow is with me. He has a son who's 2.5, one of the toddlers who became sick as a result of this outbreak. He's in Calgary. And John, I thank you for joining me this morning.
Thank you for having me on your show, Heather.
How's your son this morning, John?
He's doing well. He seems to be recovering very well. He's, I think, back to his energetic self. Needs to catch up on a little bit of sleep, but otherwise he's doing well.
Well, we can be very thankful, I'm sure, for that after stressful and frightening days. I know his illness had you in hospital day after day after day, and I'm wondering if you can share that experience and just how sick he became.
You know, that was actually part of what was confusing about it, I think, was that he wasn't really initially very sick, what with the diarrhea and the vomiting. We had a very light go, all things considered with that. And so because of the way that the situation was communicated to us, we really didn't think much of it at the time. It was initially communicated as a GI outbreak. It seemed as though he just was mildly afflicted. And so we went about our business. But supposedly there's no connection really between the severity of the diarrhea symptoms and the severity of the HUS symptoms. And so once we went to the hospital and started going with routine blood work, the situation became quite scary, quite alarming. And luckily he was cleared after, I think we were in the hospital for 6 days, for about 6 hours a day. So he was never admitted. He was never that serious, but there were certainly a lot of worrying signs in his blood work, and there were some very tense days in there.
Worrying signs. What was the blood work revealing as far as the impact, John?
His platelet levels were trending downwards, which I guess is indicative of like his kidney function. In addition to that, he had blood in his urine, all of which are indicative of the toxicity that's related to HUS.
Wow. The doctors have told me this week that generally the body heals itself in time. And thankfully, as you said, he didn't have to be admitted. So many children have been. But thankfully, in your case, he has continued to improve. But I'm envisaging that hospital experience, 6 or 7 days in a row, hours at a time, looking across that emergency department. I'm imagining you're seeing parents that you usually see dropping off your children at daycare potentially there. And there you are all in this hospital situation. What was that experience like?
Oh, it was frightening and confusing and really heartbreaking, I guess, is the easiest way to describe it. I think everyone was putting on, as brave a face as possible for the children who really just had no idea what was going on, and trying to stay strong for them, who I was just constantly struck by how remarkably strong children are, how remarkably resilient they are, and how positive they are. All the parents, you could see the tension and the fear and the stress and the fatigue of the situation, and the people that were on the edge of really breaking under pressure, basically, but keeping it together for their kids. And at least speaking for myself personally, taking a lot of inspiration from how my son manage the situation with bravery and with patience that frankly I didn't show.
Isn't that fantastic? I hope it hasn't had an ongoing mental impact. Thankfully, 2.5, maybe a little bit too young to absorb the full impact, but you felt it full on. And those emotions that you experienced and shared with the other parents, we're getting a sense of that in some of the comments we're hearing now. We're certainly seeing it in the open letter to the Premier that you yourself signed, I know. We're going to hear, John, from Premier Smith in just under 2 hours, as I was saying. What do you want to hear from her? What do you need to hear from the Premier at this point?
I would like for her to identify a need for change in some key areas that I think the letter mentioned and gestured at. I don't know what to expect in terms of a concrete plan that comes out of this address. But there's quite clearly a need for change, in my opinion. First of all, the fact that a kitchen was able to operate like this after repeat infractions of the same nature. It's horrible to think about children sitting around sharing food that was served from a kitchen like this. And I think that if the regulations support the operation of a kitchen like this, then the regulations need to be investigated very, very seriously, because they're not protecting the most vulnerable people among us. So I think that's first and foremost. And I would also like to identify a need for change around transparency around how these sorts of things are reported to parents and how information is made available. I think that there should be posting of this information at the entryway to daycares about how they're graded on these sorts of health and safety measures with regards to food safety, with regards to the child minding aspects of their care as well. And that information should be visible and public in the way it is with restaurants in some jurisdictions.
So those kinds of things for which you want answers, do you think they need to be addressed in a full public inquiry? Because she's raised that as a possibility here.
Yeah, I think that that would be the right level of scrutiny and the right level of visibility. This affects hundreds and hundreds and hundreds of families. And we need to take seriously how significant this health issue is, this health crisis is.
Yes.
The fact that it's affecting the most innocent among us.
I need to ask you one question quickly before I let you go. When your son is well enough to return to daycare, what decisions have you made?
That's a big question. We really haven't made any long-term decisions. He won't be returning to daycare immediately. We are in a fortunate enough position that my wife is just about to go on maternity leave again, and we're able to get through the next few weeks without returning to daycare. The only decision we have made in this regard is that he would never return to this daycare.
Understandable, John, given what you and your family have been through. Wish your son continued recovery and you the answers that you're looking for. Thank you very much for being my guest today.
Thank you so much, Heather. I appreciate it.
I appreciate your sharing the story.